The other thing that has recently come to light in terms of microglia is that microglia may develop a functional memory, causing increased disease susceptibility. You activate them once, they just don't go back to a resting state, but rather they stay hyper alert for a second activation. So multiple traumas, multiple experiences lead to potentially turning on the microglia on an ongoing basis. One of the studies coming out of this was looking at binge drinking in adolescence, and what it found was upregulation of the microglia such that it stayed upregulated well into adulthood. That leaves these kids at phenomenal susceptibility in terms of brain damage later in life and potentially long-term permanent consequences from their binge drinking in adolescence. So microglia have memory. The reason this is important is because it tells us that we have to move our thinking from event-oriented disease to process-oriented disease. It tells us that neurophysiologically, we need to be taking a look at what's going on in an individual's background to understand how they arrived at where they are today. What do I mean by this? I had a woman come in to see me a few weeks ago who was involved in a car accident when she was 18 years old. She struck her head at that time, suffered a mild concussion. Over the next 2 years, you saw a devolution of a disease process in her where she was eventually diagnosed with fibromyalgia. She got generalized chronic pain. And everything's been focused on trying to treat that since, which makes all the sense in the world, except that let's step back and take a little more history from her. We take a little more history from her, we find that when she's 12 years old, she's raped. And she's raped and still suffers with post-traumatic stress syndrome. When we talk about it, she's back in tears, she's shaking, she's fully reliving the moment. So now what I have is I have a brain that was primed at age 12 for a second trauma to develop what now comes out as fibromyalgia, okay? And I don't think that fibromyalgia is a disease per se, by the way. I think fibromyalgia is the end result of a process of multiple assaults on the nervous system that have a common expression in terms of pathology. So in this particular case, in order to work with this woman, we are going to have to deal with the PTSD in addition to all of the consequences of the traumatic brain injury. So what are all of the things that have become additive in creating this process? Chronic pain and chronic depression are both neurodysregulatory and neurodegenerative processes. These are serious diseases with long-term consequences. Each makes the other worse. Each have common neurophysiologic pathways, and we have to be prepared to treat the totality of the individual and not just the individual symptoms showing up at our doorstep. This is central sensitization syndrome. This is a nervous system in which the pain now originates in the central nervous system itself and is no longer connected to the incoming signals. So the incoming signals from the periphery are over-exaggerated or misinterpreted as pain. Touch becomes pain. Barometric pressure changes become pain. This is where the nervous system now is the generator of the pain. So now what we're talking about is understanding how pain, depression, and chronic illness is created in the body. So what are the etiologies of central sensitization syndrome? We've actually already outlined them by virtue of understanding the neurophysiology of microglia. So trauma, both physical and psychological, infectious processes. I do not have absolute proof that Lyme disease, chronic Epstein-Barr, or parasites actually activate microglia. We're not there yet. But I do know that infectious processes in the periphery will activate microglia, and so I think it's a reasonable supposition to suggest that these diseases are also having impacts at that level. Toxins, heavy metals, lead, mercury, which are abundant in the environment. Biotoxins, which we've not talked about, but these are individuals that we work with who have exposures either to toxins produced by molds or toxins produced by poisonous spiders or toxins produced by ticks. An example of this is a young woman that we saw. She was 17 years old at the time that we saw her. When she was 15 years old, she had been kicked in the knee and she developed a complex regional pain syndrome, swelling, severe pain to any touch or movement. This progressed into a generalized pain syndrome, and she had pain everywhere. This is true central sensitization syndrome. She was seen at a large number of by a large number of physicians and at several centers, and she was seen by one physician at University of Pennsylvania, who takes kids who suffer with these conditions, puts them through a very vigorous physical therapy program in an attempt to reset the pain receptors, and doing physical therapy multiple hours a day, every day of the week. After a couple of weeks of this program, she was in fact significantly improved to the point where she was able to go back to school. However, within 2 months of returning to school, she starts to deteriorate in terms of increasing pain. She has chronic daily headaches and severe fatigue. So we started working with her. And the question again became, okay, what happened prior to the onset of the disease? And if we look back, when she's 13 years old, she has a documented case of Lyme disease, which was treated. She has this poisonous spider bite, which was successfully treated. And then she gets a second case of Lyme disease, documented and appropriately treated at the time. So we now have a nervous system which is set up for the development of central sensitization. Now she gets kicked, a relatively minor injury into her knee, and develops into this full-blown pain syndrome. This is central sensitization. It's a process. It's not an event. We treated her for biotoxins, all right? And we used Richie Shoemaker's protocol, where we followed using cholestyramine in order to help remove the biotoxins from the body. Over a course of time, about a month, as a matter of fact, we were able to completely eliminate the headaches. Within 6 months, all of the fatigue was gone, and we shipped her off to college. She gave us a gift. The gift was, while at school, she got another poisonous spider bite. All right? I've managed to go through my entire life without having any poisonous spider bites. This child seems to attract them. So she gets the second poisonous spider bite, and what happens? All the symptoms return. We again treat her for the protocol for biotoxicity. All the symptoms remit. All right, this was a number of years ago. She's managed to stay away from spiders and ticks during that time period, has been extremely healthy, and we saw her within the last year, and she's now married and having a wonderful life. So there's a number of etiologic factors that come into this business of central sensitization, and we've got to be prepared to take a look at the totality of what's happened to an individual. All right, medications. This is where we get back to talking about the business of opioids and benzodiazepines. Two of the drug classifications that we use most commonly in the treatment of chronic pain disorders, and certainly benzos frequently used for treatment of anxiety associated with depression or just pure anxiety disorders. We now know that these drugs upregulate the microglia. That is, they make them more active, they put them into a state where they're constantly secreting inflammatory processes, and my bet is that while in one sense we're helping the situation, in another sense what we're probably doing is locking people into their pain problem, their anxiety disorders. So the odds, so while we'll cover up the symptoms, we will never be able to get them out of their condition because we're facilitating the upregulation of microglia with these medications. Sleep disturbances, sleep apnea, hypoxia induces the occurrence of activation of microglia. We see in sleep apnea where individuals are, if you look at them, their lifespan is decreased anywhere from 6 to 9 years. They have much higher incidence of stroke and heart disease. All right, I think probably this is being mitigated through microglia activation. Repeated microglia activation, because it's usually a number of years before the diagnosis of sleep apnea is made. We've got to be vigilant in looking for these problems, and we've got to go after them in order to get a more complete resolution of the disease process. Circadian rhythm disorders give us clue that there's probably problems with axis of the hypothalamic pituitary adrenal axis. If there's chronic pain that's keeping them awake, we need to be attentive to this stuff, because all of this is going to feed back in keeping the brain in an inflammatory condition. Thyroid disorders, nutritional issues, vitamin D deficiency, magnesium deficiency. Magnesium is particularly interesting because one of the receptors that activates pain is the NMDA receptor, which is activated via glutamate. Now, NMDA receptors are shut down, they're closed down by a magnesium molecule sitting on top of that receptor. If magnesium gets displaced, calcium enters and the NMDA receptor becomes activated, activating a pain process. All right, so if you're magnesium deficient, then the problem's probably going to be exacerbated by having the NMDA receptors hyper-responsive. All right, now keep in mind, where's magnesium in the body? 60% of magnesium is sitting in the bone, 38% of magnesium is sitting in the tissue, and 2% is sitting in the serum. The serum levels are preserved at the cost of the intercellular levels. So if you measure serum levels, all you're getting is potentially finding end-stage disease, but you won't find anything prior to that. You have to measure intercellular levels in order to be able to get an accurate level state for the magnesium in an individual. Celiac disease. This is part of the autoimmune cascade of what's going on in these individuals. Celiac disease is an inflammatory process that's going on because it's an autoimmune process. It causes disruption of the gut mucosal barrier. That relates back to a whole other lecture and discussion that we'll have on celiac disease. But the fact of the matter is, these diseases play on each other, and these are things that we have to go looking for in order to really reduce inflammation in the body on all levels.